Hello and welcome to Victoria University. I'm Anastacia Salamastrakis and today I'll be chatting to Professor Vasso Apostolopoulos. She leads the immunology and translational research team within the Institute of Health and Sport here at Victoria University. Our discussion today will begin in English and then we'll be continuing with a short conversation in Greek for our Greek-speaking viewers. Vasso, thank you for your time today. You and your team are conducting important research that could lead to a vaccine for COVID-19, and you're also looking at whether existing medications or drugs could help us treat the virus. We're going to talk about that in a little while and how people can support your research. But first, if you could start by telling us a little bit about yourself. How did you start in immunology and what actually led you to vaccine development?
So I was a student at Melbourne University. I was doing immunology and pathology research, physiology, and in third year one of the lecturers came down, and it was just before exam times, and he came down and he gave us a research paper that he had published, which was on HIV and how HIV gets into the cells and what does it do to the body. And he told us that in order to catch our interest, he told us that we'll be examined on it. But mind you, none of that paper was not on the exam. But we read it because we thought we're going to be examined on it. So when I read that paper, I just got fascinated by the research, and I thought, wow, can you actually do this sort of research? Because I thought, I'll go on to do medicine or dentistry or something else. But I got so intrigued by this research paper that I thought, that's what I want to do. I want to do research. So I then went on and did honours at the Austin Research Institute. It was part of Melbourne University, and I did my research. I went on and did a PhD, and then we started working on vaccines and on cancer at the time.
Yeah, and fast forward a few years, you and your team have already developed a number of vaccines against cancer, and you're also working on vaccines for things like multiple sclerosis and juvenile diabetes. How have you been able to do this?
Just from my passion for research. I've got an enthusiastic team over the years. I have lots of research assistants, postdocs, students that come in and out of the lab, and it just excites me to, transfer my knowledge to my students and develop my students as well and my postdocs. And I've just got a really good, enthusiastic team, and the work gets done.
Great. Earlier this year, the team had to switch its focus. You turned your attention to COVID-19 and trying to develop a vaccine. Why did you believe that was the important thing to do?
Well, having 25 years of research, immunology research behind me, and developing vaccines for various disorders, I thought it was just natural to also use the methodology that I had used and modified a few methods of trying to develop vaccines, and I thought, well, it's a natural step to try to also try and develop a vaccine for COVID. There's an urgent need worldwide for a vaccine for coronavirus. It's really hard, everyone's trying to get back to normality, but really, in essence, we need a vaccine to immunise the whole population before things can really go back to normality. So I thought, it's a big global importance, and there's a lot of research labs around the world that are trying to develop vaccines. Everyone's trying to use a different methodology. My approach is, again, a different method to what everybody else is using. So I thought, let's try it, and hopefully one of the methods, whether it's mine or anyone else's around the world, hopefully one of them will be successful and we'll be able to globally immunise the population.
You talked about normality, and over the past few weeks we have seen that life has slowly started to return to normal here in Australia and indeed many parts of the world. Given that, is developing a vaccine still critical?
Well, things won't go back to normality because COVID-19 will always be there. It's not going to go away, so we definitely need a vaccine to vaccinate the population. And what I've seen in the last few weeks, Personally, I think we're a little bit rushing to get back to normality. I think everybody's excited, they want to go out. The shopping centres are full, there's people out in the streets, it's full, but really we have to be careful because there are still active cases. Worldwide, there's 3 million active cases worldwide at this particular moment. So this, if you think about it, coronavirus and the pandemic started with one person being infected in China, and look what happened. So at this particular moment, there's 3 million people in the world that are out there that we know of that are infected of coronavirus. There are also asymptomatic people that we don't know that they're affected, and also people that haven't been tested. They've just got symptoms, but they haven't been tested. So this is 3 million of the tested cases, and that's a lot of people out there that are positive for coronavirus. So it's really important to develop a vaccine and to not rush into going back to normality, because normality won't happen for at least 18 months to 2 years.
Okay, that's a very timely warning. We know then that vaccines do take many, many years to create. How soon do you think your team would be in a position then to develop something that might be ready for human trials?
Well, to develop a vaccine, actually, it doesn't take a long time. There's different ways of making the vaccine. So first of all, all the labs around the world they're either using peptides, which is purely synthetic, which is part of the virus and synthetically made as a peptide. Others are producing proteins, which is again part of the virus. It's not the whole virus. It's just regions of the virus that we believe is important to mount an immune response. Other labs are using mRNA, so RNA extracted from parts of the virus, not the whole virus. So that's the first thing that you need to do for a vaccine. And then the second thing is to have a delivery system, something to deliver these artificial or synthetic proteins, peptides, or mRNA, to deliver it to the body so the body can see it and mount an immune response. So in regards to the method that we're using, we've already developed different methods that we know is able to deliver these proteins or these peptides to the immune system and mount an immune response. So we have the know-how and the technology to do that. As soon as we have the proteins available and ready, because this is to do that, to do the conjugations, and it takes about a week to make a vaccine because we know how to make it. And then we'll have you have to do some animal testing to show that it mounts an immune response in an animal, and then be ready to do some toxicology studies, and then go into human trials. So it all depends on funding, and if there's adequate funding, we could fast track it and get it done in a month. If there's no funding or very little funding, then obviously things take longer to do. But it's not a very long process. It's just a matter of how fast can you do it with the funding available.
Yeah, so you're quite confident it could be sooner rather than later?
Well, yeah. As soon as we have the proteins and we just we do we've done the conjugations, and we're waiting for some other proteins and ready to do some animal testing. It won't take long to do it in humans.
That's good to hear. So obviously an effective vaccine is something that could prevent us from getting coronavirus in the first place. But what happens to those, and you mentioned that there are a number of infections in the community already, what happens to those of us who do end up getting infected? Do you think there are any drugs out there that might be able to be used to treat the virus? And what efforts are your team doing to look for those?
So a few drugs have been identified, and they have been tested in humans. The most popular one, or the one that's most known, is hydroxychloroquine, and they've actually now shown some studies that were done were not properly done by the researchers, and now they've sort of taken that out from human testing. There's a few other rheumatoid arthritis drugs. There's a few antibacterial drugs that have. And malaria drugs that have the capability of that might have antiviral activity, that have shown promise. How do people do this? And what we're also doing is, we know the crystal structure, we know the structure of various proteins that make up the virus, and basically we identify pockets within that protein, and we've screened about 3 million FDA-approved drugs and also compounds that can be used in humans. So this is something to fast track because we already know they've been used in humans, and we're just trying to see which ones fit best into these pockets. We're doing antibiological activity of the drugs. We've screened about 3 million of them. We've come up with about 500. We had 1,000, but now we've cut it down to about 500 that show potential to have antiviral activity, and we're doing those tests at the moment. and there's quite a few promising ones that are there. So basically these are repurposing already approved drugs to go into human clinical trials. So you don't have to go through all those approvals, etc., because they're already approved in humans. So that's one aspect. Screening drugs, looking for antiviral activity and testing them in humans, and there's a lot of them that we have, common drugs that people are using for various diseases. A lot of them are shown potential for antiviral activity. In addition, that's for the FDA repurposing drugs and compounds. That's for fast tracking into humans. So the other part of the research is purposely designing drugs that will fit into these pockets. So there's a pocket in the virus. Fit a drug specifically in there that will have antiviral activity. That will take a lot longer because you'll need to show toxicity studies, stability of the drugs. You need to do larger animal toxicities as well. And then you have to start the clinical trials from the beginning in humans. So you do phase 1 testing to check for toxicity and side effects in humans, and then you go for efficacy, other studies. So that will take a little bit longer, but there is a lot of drugs out there that look like they potentially could kill the virus. So I think it's very important also to come up with drugs to be able to help decrease the viral load in those people that have COVID-19.
Okay, that sounds like great news. There is still a lot that we don't know about COVID-19, and some of your research and your team are looking at better understanding that, for example, why men are more susceptible. Can you talk a little bit about that?
Yeah, so I mean, one thing that's not clear is why people get different responses. Some people are asymptomatic, others have minor symptoms, severe symptoms, others die. So we're trying to understand why there is that difference. And if you can understand the differences, how people react differently, then we'll be able to design better drugs and vaccines based on that. But also, there's some evidence about the blood type people have. Men are more susceptible to women. It might have something to do with the hormone, the sex hormone. There's also genetic variations. So we're looking at all those aspects to try and understand the pathophysiology of the virus and what happens. Because if you could understand what the virus does and why people behave differently, then we could be able to enhance our drugs and vaccines.
What sort of lessons have you learned over the years that you're now applying to this research?
Well, over the years, immunology has advanced at a really fast pace. So, we think technology has advanced. There's a new phone, there's a new computer every day. Technology is advancing. That's how fast medical research is advancing as well. So, if you go out of research for 1 year and you get back into it, you've fallen so far behind. That's how fast it's advancing. So, we've learnt a lot in immunology about the immune system, about drugs, vaccines, how the body interacts, how diseases occur due to defects in the immune system. So there's a lot that we've learned over the years, and we're applying them to all our research now. When generally, more improved drugs and vaccines are becoming available, and treatments for various diseases, and also we're applying it for the COVID-19 research.
And do you think vaccine development is easier now than perhaps when you first started?
I think, it's easier. There's easier and harder. It's easier in regards to we know more about the immune system. There are more technologies available. We could understand defects better. We could design better vaccines because there's all these new technologies. That's probably one of the easiest steps because we know a lot more. The harder one is 20, 30 years ago, getting something into humans was a lot easier than now. Now to get something into humans, it's so strict. There are so many guidelines that you have to follow that it takes a lot longer to get something into humans than what it was 25 years ago. So when we started off doing vaccines in humans, we made the vaccine in the lab and we went straight to humans. There wasn't that much paperwork involved, but now it's just paperwork this thick and it's just really strict guidelines. So that's good and bad,
Okay. And what keeps you motivated? What keeps you going?
Generally in research, or what keeps me going? just the excitement of trying to develop something and help to try and help people overcome the diseases. One of the highlights was about 2 years ago. I was in Greece, and this lady came up to me, and because it was a big an award ceremony that I had received from the president of Greece. There was a lot of people there, and this lady comes up to me, and she says, she started talking to me, and she said to me, "You know what? 25 years ago, I took your vaccine." She had breast cancer. She goes, "I took your vaccine, and because of you, I'm alive today. And because of you, I saw my children grow up, and now I've got grandkids." And she just hugged me, and that, like, I know the results of our research, but you never come in contact with the patients because the clinicians are involved. They take care of the patients, they inject them, and the researchers are not involved in these patients and even the outcome, what's happened to them 25 years later. But it was just the best feeling ever, just feeling that I got goosebumps all over my body, thinking, wow, this lady took the vaccine 25 years ago and she's alive, and she had got an immune response and she reacted to it properly, and she's alive and she's got grandkids. So it was just fascinating. Like, stories like that is what keeps a researcher motivated and wants to keep going.
That's wonderful, that's great. And hopefully the same reaction with COVID-19. What could happen though if we can't develop a vaccine or we can't find effective drugs for COVID-19? What will the world look like?
Well, if there is no vaccine for COVID-19, COVID-19 is going to be there, whether we have a vaccine or not. The problem is it will be there and people will contract COVID-19 and still spread it. It's highly infectious, and so we still have to keep our social distancing and be careful, wash our hands, and be really careful with our everyday life. It won't be it won't be back to normal. But I guess, over the years, people are talking about herd immunity. People will get infected, and eventually, naturally, some of the population will be naturally immunised or protected against the virus because they've had the virus and they've mounted an immune response and they've recovered. A vaccine, it's very hard to make a vaccine. So researchers tried to make a vaccine to SARS, which was the first coronavirus, SARS-1. This is coronavirus SARS-2. That was in 2002. In 2012, there was MERS, which was the Middle Eastern respiratory syndrome, which was a coronavirus as well. And this is the third one. And for the other two, researchers tried to make a vaccine and they were not successful. So it's a harder virus to develop a vaccine, but there is, a lot of researchers around the world developing vaccines, and in the hope, if 100 of them get tested in humans, in the hope one of them would work and will be the successful one. So there is a lot happening. If a vaccine does not develop, we'll have to still keep our social distancing and not go in crowded places.
Yeah, let's hope you do develop it, whether it's yourself or others, as you say. So for those who are watching today, how can they help support your efforts? So
research, everything depends on funding, no matter what research you do. And so, you could fast track something if you have funding. If you don't have enough funding, you could get to a certain point and then the research just stops. You can't then take it on into human trials. So what costs a lot of money is the human trials and the clinical testing, scale up of the vaccine, produce it in a manner not like how you're producing it in the lab. You have to produce it in special labs, so it could be highly purified and for human use. I mean, that's what costs a lot of money, and the clinical trials. So making vaccines, doing all the research does not take a long time. But everything depends on funding. The Victoria University has supported my research to a certain degree, so we're able to get to a certain point, but beyond that, we can't fast track these or do any clinical studies because it needs a lot of funding. So Victoria University have started up a fundraising. They've got on their website, they have donations for people to donate. And at the moment, every dollar that a person donates, Victoria University will match it. So it'll be dollar for dollar matched by Victoria University.
And that will help your efforts, you think?
That will definitely help and fast-track my research, and will get the vaccines and the drugs that we are developing into humans. Otherwise, they'll just stay in our fridges.
Right, and that's not where we want them.
Good. Yeah, well, not really.
Absolutely. Thank you so much for your time today. Really appreciate it. It's been fascinating listening to what you've done and what you hope to do. It sounds like you're on the right track, and definitely, great efforts being made in this area. Good luck. For those who'd like to learn a little bit more about Professor Apostolopoulos and her research, and also if you'd like to make a donation, we encourage you to go to the Victoria University website where all the details can be found. As Professor Apostolopoulos mentioned, all donations are currently being matched dollar for dollar, so your donation will definitely help in that regard. Thanks again for watching, and also for our Greek-speaking viewers, please stay with us. We will be continuing the conversation in Greek. It'll be a shorter conversation, but Vasso and I will attempt to answer some of these questions in Greek. Stay with us, and we will be back shortly. Thank you. Γεια σας και... Γεια σας και καλώς ήρθατε στο Πανεπιστήμιο Victoria University. Είμαι η Αναστασία Σαλαμαστράκη και σήμερα θα μιλήσω με την καθηγήτρια Βάσο Απostolopoulos για την έρευνά της. Βάσο, σας ευχαριστώ για το χρόνο σας σήμερα. Οι δύο μας είμαστε γεννημένοι εδώ πέρα στην Αυστραλία, αλλά θα προσπαθήσουμε να μιλήσουμε ελληνικά. Νομίζω θα τα καταφέρουμε. Κάνετε σημαντική έρευνα που, αν όλα πάνε καλά, θα μπορούμε να βρούμε ένα εμβόλιο για το COVID-19. Και επίσης προσπαθείτε να κοιτάξετε τα φάρμακα που μπορούν να μας βοηθήσουν. Πόσο σημαντική είναι οι προσπάθειές σας?
Οι προσπάθειές μας που κάνουμε είναι πάρα πολύ σημαντικές, γιατί είναι κάτι που ήρθε απρόπτα. Εκεί που δεν το περιμέναμε έγινε μια πανδημία και χρειαζόμαστε και φάρμακα και εμβόλια για να μπορούμε να ξεπεράσουμε αυτή την πανδημία. Οι προσπάθειές μας είναι να φτιάξουμε ένα εμβόλιο για το κορονοϊό και είναι λίγο... Έχουμε 25 χρόνια εμπειρία πίσω μας, ειδικά που έχω εγώ, η δικιά μου ομάδα, και έχουμε φτιάξει εμβόλια για διάφορες ασθένειες και ξέρουμε πώς να φτιάξουμε τα εμβόλια και χρησιμοποιούμε την ίδια μέθοδο για να φτιάξουμε εμβόλιο για το κορονοϊό. Και οι προσπάθειές μας είναι πολύ σημαντικές αυτή τη στιγμή και ήδη και για να φτιάξουμε φάρμακα, και αυτό είναι σημαντικό γιατί υπάρχουν πολλά άτομα που έχουν πάθει το κορονοϊό και χρειάζονται ένα φάρμακο για να προσπαθήσουμε να μην πεθάνουν τα άτομα που έχουν πεθάνει, να μην πεθάνουν άλλα άτομα. Με μερικά φάρμακα, άμα βρούμε φάρμακο, να μπορούμε να σκοτώσουμε τον ιό για να μην αρρωστήσουν χειρότερα.
Okay. Είναι δύσκολα πράγματα να βρεις ένα εμβόλιο. Χρειάζεται χρόνια να περάσουν. Πόσο σύντομα πιστεύετε ότι θα μπορείτε να κάνετε ένα εμβόλιο για το COVID-19 που θα είναι έτοιμο να το δοκιμάσουμε πάνω στους ανθρώπους?
Κοιτάξτε, για να φτιαχτεί ένα εμβόλιο από την αρχή κάνει περίπου 10 με 15 χρόνια για να φτιαχτεί ένα εμβόλιο ή να φτιαχτούν φάρμακα από την αρχή. Αλλά έχουμε πολλά χρόνια εμπειρία πάνω σε φάρμακα και σε εμβόλια που έχουν δείξει ότι δουλεύουν για άλλες ασθένειες και χρησιμοποιώντας αυτή τη μέθοδο μπορούμε να φτιάξουμε εμβόλια και μπορούμε να βρούμε φάρμακα πολύ γρήγορα, γιατί δεν πρέπει να αρχίσουμε πάλι από την αρχή. Έχουμε αυτή την εμπειρία και κατευθείαν θα χρησιμοποιήσουμε τη μέθοδο που έχουμε ήδη φτιάξει τα τελευταία 20-25 χρόνια. Δηλαδή, μπορούμε να κάνουμε ένα εμβόλιο μέσα σε μερικούς μήνες. Μπορεί να φτιαχτεί εμβόλιο και μετά να πάει σε ανθρώπους. Μπορούμε να το κάνουμε πολύ γρήγορα. Μετά, αφού μπει σε ανθρώπους, πρέπει να περάσει τουλάχιστον ένα χρόνο, να σιγουρευτούμε ότι δουλεύει στους ανθρώπους, δεν υπάρχουν παρενέργειες κτλ. Αν υπάρχουν αρκετά χρήματα, μπορούμε να το κάνουμε γρήγορα και μέσα σε 1,5 χρόνο με 2 χρόνια μπορεί να είναι έτοιμο κάτι για να χρησιμοποιηθεί για όλο τον κόσμο.
Μπράβο. Για αυτούς που μας παρακολουθούν σήμερα, πώς μπορούν να σε βοηθήσουν?
Κοιτάξτε, η έρευνα πάει βάση με τα χρήματα που υπάρχουν. Πάρα πολλές έρευνες έχουν γίνει σε όλο τον κόσμο για πολλές ασθένειες και στο δικό μου το εργαστήριο. Έχουμε 18 θεραπείες που κάθονται στα ψυγεία στο δικό μου το εργαστήριο. Το ίδιο είναι και με τα άλλα εργαστήρια σε όλο τον κόσμο. Οι θεραπείες υπάρχουν, οι ερευνητές φτιάχνουν φάρμακα, φτιάχνουν εμβόλια, αλλά ο ερευνητής μόνο μέχρι ένα σημείο μπορεί να πάει. Μετά δεν μπορεί να συνεχίσει αν δεν υπάρξουν χρήματα να δοκιμαστεί σε ανθρώπους. Και δυστυχώς, αν δεν υπάρχουν χρήματα, ό,τι και να κάνει ο ερευνητής θα το βρει, άμα μπορεί να βρει εμβόλιο ή φάρμακο, αλλά θα μείνει στο ψυγείο γιατί δεν υπάρχουν χρήματα. Είμαι πολύ χαρούμενη που το Victoria University έχει βοηθήσει την προσπάθειά μου για να φτιάξουμε εμβόλιο και να βρούμε φάρμακα. Αλλά είναι αρκετά μέχρι ένα σημείο. Για να μπορούμε αυτό να το κάνουμε σε ανθρώπους δεν υπάρχουν λεφτά. Με έχει βοηθήσει αρκετά το Πανεπιστήμιο, αλλά ήδη χρειάζονται περισσότερα βοήθεια από όποιους μπορεί να βοηθήσει. Και το Πανεπιστήμιο έχει ανοίξει στην ιστοσελίδα του Πανεπιστήμιου της Βικτόριας. Έχουν βάλει ένα link που μπορούν να πατήσει ο κόσμος για να κάνουν δωρεά για την έρευνα. Και αυτή τη στιγμή το Πανεπιστήμιο θα δώσει $1 για κάθε $1 που κάποιος θα βοηθήσει την έρευνα. Δηλαδή, άμα κάποιος δώσει $100, το Πανεπιστήμιο θα δώσει άλλα 100. Που αυτό είναι πολύ σημαντικό και είμαι χαρούμενη που το Πανεπιστήμιο βοηθάει την έρευνα μου με αυτόν τον τρόπο και όλος ο κόσμος, εάν μπορεί να βοηθήσει, θα μαζί. Δηλαδή, εμείς είμαστε ερευνητές, αλλά χωρίς το κόσμο δεν μπορούμε να κάνουμε τίποτα και όλοι μαζί, άμα βάλουμε την προσπάθεια μαζί, μπορούμε μαζί να το φτιάξουμε.
Μπράβο, συγχαρητήρια και κάθε επιτυχία. Ευχαριστώ πάρα πολύ που μας μιλήσατε σήμερα. Όπως είπε η καθηγήτρια Αποστολόπουλο, μπορείτε να βοηθήσετε. Οι λεπτομέρειες είναι στο Πανεπιστήμιο, το Victoria University, το website. Υπάρχει εκεί πέρα link, όπως είπε, και μπορεί να βοηθήσετε. Και σας ευχαριστούμε πάρα πολύ σήμερα που κοιτάξατε αυτό το interview με την καθηγήτρια Vasso Apostolopoulos. Ευχαριστώ. Γεια σας.